Hi everyone. I'm Tingting Zheng from Harbin Institute of Technology, China. We present a dynamic policy-driven adaptive multi-instance learning method for whole slide image classification. This work was completed under the guidance of Professors Jiang and Hongxun Yao at Harbin Institute of Technology. Histopathology slides provide detailed information on the morphology and scale of tumors. However, complex biological structures in these slides present a challenge for pathologists to discern intricate variances. Recently, digital whole slide images have emerged as effective diagnostic aids. However, due to the irregularities of tumor tissue and the gigapixel resolution of WSIs, obtaining high-precision images is laborious and time-consuming. This naturally raises the question: how to extend supervised methods to weakly supervised methods for efficient and accurate diagnosis of WSIs. Multi-instance learning (MIL) schemes emerge as the times require, providing alternative solutions to extend supervised DL methods to semi-supervised DL methods for WSI analysis. Specifically, each WSI is described as a bag containing numerous instances sampled from the WSI. A bag is labeled with a positive or negative tag, but its instances are label-free. The core mission of MIL-based methods is to aggregate information from all instances to provide bag-level predictions, which can be summarized into instance sampling, feature representation, and decision-making. According to the grouping of instances, these methods can be broadly divided into two categories: bag-level and pseudo-bag-level methods. Bag-level-based methods pack all instances or embed their features into the model to regress the final prediction. Besides the computational and memory burden, identifying the most informative features from thousands of patches is non-trivial. In particular, since the mutual relationships among instances are barely explored, the distribution biases between minor tumor regions and extensive normal tissues exacerbate the risk of model overfitting. By contrast, pseudobag-based methods leverage clustering or random schemes to decompose all instances, or embedding features into multiple classes or groups, denoted as pseudobags or subbags. Then, the bag labels are assigned to the pseudobags as pseudo-labels, resulting in substantial improvements. However, notably, the preprocessing for clustering and pseudo-label generation is tedious. Besides that, there are at least two other shortcomings. 1. The tumor instances may be scattered across wide groups, especially for WSIs with small and dispersed lesions, where the informative features are diminished, consequently increasing the risk of false negative reactions. 2. Pseudobags derived from random sampling disrupt intraclass instance homogeneity, while those derived from clustering may overly prioritize contextual similarities irrelevant to the label. Both strategies heighten the risk of misalignment between pseudobag features and bag labels, leading to prediction errors. By reviewing the procedures of existing MIL methods, WSI analysis can roughly be decomposed into three subtasks: instance sampling, feature representation, and decision-making. However, most MIL-based technologies rarely explore the mutual relationships between these tasks, and suffer from one or more of the following problems: 1. Requiring high storage and intensive preprocessing for numerous instances. Sampling. 2. Potential overfitting due to limited knowledge for predicting bag labels, feature representation. 3. Pseudobag counts and prior biases affecting model robustness and generalizability, decision-making. This inspires us to ask the following question: can more elaborate and simplified sampling schemes and information aggregation mechanisms be developed to capture the most discriminative features for accurate prediction? Recently, some efforts have highlighted that the current decision can benefit from past knowledge and continuous learning. However, the latent priors among instance sampling, feature representation, and decision-making are barely exploited. Introducing past information for guidance naturally raises two issues. 1. How to sample the most informative instances from the rest of the sampling bag. 2. How to aggregate historical features for robust decision-making. To this end, we propose a dynamic policy-driven adaptive multi-instance learning (PAML) framework for WSI classification. PAML consists of a dynamic policy-driven instance selection (DPIS) scheme, a selection fusion feature representation (SFFR) module, and a transformer classification module (TCM). DPIS learns relationships among past, current, and remaining instances of the bag and samples instances embedded as feature vectors using a feature extractor (FE). Then, SFFR takes the feature vectors and an initial token as inputs, refining the token by using a transformer module (TIM) and a multi-head attention (MHA) mechanism to fuse the current token with past tokens. Meanwhile, we introduce a Siamese (SIA) structure between adjacent tokens to enhance the robustness of tokens. Finally, TCM uses a class token to aggregate all tokens for inferring the bag label probability of WSI, providing feedback as reward and penalty to the DPIS. To aggregate the knowledge of continuous sampling stages to promote more distinguishable features and sampling, we propose a selection fusion feature representation (SFFR) strategy and construct a dynamic policy-driven instance selection (a DPIS) scheme. In addition, to avoid forgetting historical information, the class token (CLS) in the transformer is fully exploited to produce more precise bag representations and label predictions. To achieve collaborative learning between feature representation and predictions for high-quality representation and better decision-making, we explore practical composite constraints on bag probability, pseudo-bag probability, and contrastive learning involving bag cross-entropy loss, pseudo-bag cross-entropy loss, and contrastive loss. To compare our methods with 11 other representative MIL methods, we use two datasets for evaluation. For metrics, we mainly use AUC, accuracy, F1 score, precision, and recall for comparison. The representative MIL methods are employed for comparison. Quantitative results on two commonly used WSI datasets are presented in Table 1. Our PAML achieves the best prediction performance. Here we show some visual examples. Our PAML produces results with better attention to the tumor region. We construct quantitative and qualitative comparisons with different pseudobag strategies. Our DPIS scheme facilitates more accurate learning of bag representations that are closely associated with disease region. Since the proposed PAML involves multiple enhancement strategies, we carry out ablation studies to validate the contributions of individual components to the final label prediction performance. The results show that PAML containing all modules significantly outperforms its incomplete versions. Figure 5 and Table 4 show the effect of different subbag sizes and grouping strategies on prediction performance, demonstrating that our dynamic sampling scheme significantly outperforms fixed grouping strategies. We equipped 4 representative MIL frameworks with the DPSF module and evaluated them on the Chameleon 16 dataset. The quantitative results, tabulated in Table 5, demonstrate significant improvements compared to existing results. Extensive experiments have been conducted, demonstrating the impressive performance of our proposed PAML and validating the effectiveness of exploring interrelationships. Thank you for your patience. If you have any questions or concerns, please do not hesitate to email me. My email is listed above, and I will be absolutely delighted to help you.